On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore. Hello, I'm Sheila and this is on the Healthline News, Reviews and Updates for week ending the 31st of May 2019. In today's edition, the Ministry of Health and Gender Affairs receives mobile medical unit from the government of Japan. And in international news, burnout is now an official medical diagnosis, and community health nursing 5th annual report presentation. We'll be right back after these messages.
Gala WhatsApp and I send text. Me see the SMS. Me a fish show.
Send me a pic of yourself. One of you know where.
I have too much self-respect to send you a pic of you know where.
If you really love me, you will do it.
If you really love me, you wouldn't ask.
You matter to your family, to your friends, to your community, to you. Remember, you matter.
This message was brought to you by the Pan American Health Organization, PAHO, and the Nevis Health Promotion Unit.
Agents Mrs. Mihao Nawatari and Yuji Takeuchi represented Rotas Company and Nissan. Spokesperson Mihao Nawatari gave a brief introduction regarding the commissioning of the mobile medical unit to the Ministry of Health in Nevis.
We are glad to hand over this mobile medical unit to the government of St. Kitts and Nevis. And this mobile medical unit is used for local healthcare service. And yesterday we went to Ministry of Health in St. Kitts and we heard that they used it for checking HIV. So we really appreciate for your...
Dr. Judy Nisbet, Medical Officer of Health for Nevis, applauded the Japanese government for donating the medical mobile unit. She recognised the work of the Ministry of Health and spoke of the timing of receiving the equipment, particularly as Community Health recently participated in a week of workplace health screenings. Dr. Nisbet said this would enable the Ministry to better execute its outreach programmes.
One such use is for outreach activities, and therefore this donation is timely. In recent times, we have been making a deliberate shift towards conducting more outreach sessions. With the rise in non-communicable diseases, this is strategic because if persons are aware of their health status, of their numbers, such as their blood pressures, blood sugars, and so forth, the more likely they are to seek health care and to live healthier lifestyles. In fact, to commemorate World Hypertension Day, we just ended a week of outreach sessions at workplaces, and there are many more workplaces to be reached. We realized that though the 6 health centers are strategically placed around the island, certain segments of the population, for example men and adolescents, do not take full advantage of the services offered. This mobile unit will therefore give us the opportunity to reach these persons where they live, where they work, and where they play. As I said earlier, this unit can serve many purposes, and one such purpose is its use during mass events, whether it's for practice or real mass events, and also in response to mass casualty events such as natural disasters like hurricanes.
In closing, Junior Minister of Health, Honourable Hazel Brandy Williams, expressed her gratitude in receiving the keys for the mobile medical unit.
We are eternally grateful for this very worthy gift, and I am certain that the technicians would use it in the way that it is authorized to be used. I am told that the unit is multifaceted and a number of tests could be done. Some of them are HIV, pap smear, cholesterol, and blood pressure. So this is not a simple unit. It is one that will help us in reaching those persons who are sort of difficult to reach.
The junior minister stated that the healthcare on the island is not static, and receiving this mobile unit is testimony to that. The party, which included Mr. Gary Pemberton, Hospital Administrator, Mrs. Nadine Carter-Keynes, Coordinator, Health Promotion Unit, Mr. Brian Dyer, Director, Disaster Management in Nevis, and Mrs. Ermine Jeffers, Coordinator, Community Health Services and Community Nurses, were invited on board the Medical Mobile Unit to observe the content of this spectacular facility. Following the ceremony, 15 health practitioners, including doctors, nurses, EMTs and ambulance drivers, were invited to participate in a fully comprehensive training day in the management and operations of the Medical Mobile Unit. And in international news, burnout is now an official medical diagnosis, according to a recent report from the World Health Organization studies conducted by researchers over decades, and now concluding that burnout is now official medical diagnosis. Burnout is now a legitimate medical diagnosis according to the International Classification of Diseases, or ICD-11. The World Health Organization handbook guides medical providers in diagnosing diseases. It is a feeling of extreme work stress that's long been embedded in the cultural lexicon and now might be codified in your medical records. Burnout now appears in the ICD-11 section on problems related to employment or unemployment according to the handbook. Doctors can diagnose someone with burnout if they meet the following symptoms: feelings of energy depletion, of exhaustion, increased mental distance from one's job, or feeling of negativism or cynicism related to one's job, or reduced professionalism, efficacy. Doctors will go through a process of eliminating using the guidelines in handbook before making the medical diagnosis of burnout. After the break, Community Health Nursing 5th Annual Report presentation and My Healthy Kidney Jingle competition winners. We'll be right back after these messages.
Pinch.
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 Are you ready for this?
Don't pour.
Don't pour.
Are you
Don't
ready for
pour.
this? Are you ready for
Salt
this?
reduction. Protect your
Are you
kidneys.
ready for this? Are you ready for this?
The Community Health Nursing 5th Annual Report presentation was held on Thursday, the 30th of May at the St. Paul's Anglican Church Hall, chaired by Dr. Retna Warwin-Brown, Deputy Medical Officer of Health. She welcomed an attentive group of health practitioners who attended for the annual reporting presentations conducted by staff from 6 health centres in Nevis. Nurse Jeffers, Coordinator of Community Nursing, opened the ceremony with brief remarks. She hoped that the presentations would offer valuable insight into the activities and issues into community nursing. Dr. Judy Nisbet, Medical Officer of Health, gave a synopsis ahead of the presentations, to which she commended the Coordinator of Community Nursing Services and her team of community nurse managers and nurse midwives for the hosting of the 5th Annual Community Nursing Services reporting exercise. Dr. Nisbet spoke of the importance of accountability and the opportunity for professionals to reflect on their stewardship of the past year.
This is significant as it provides the opportunity for each nurse to reflect and assess the work that they have done over the past year, and for some indicators that will be discussed what you have accomplished over the past 5 years as you look at trends. It also, however, gives the opportunity to critically reflect on what you have not done or not completed and identify the challenges that you face. We will look at gaps and together during discussions brainstorm solutions.
In closing, the Permanent Secretary in the Ministry of Health and General Affairs, Ms. Shalisa Martin-Clark, in her remarks noted that the reporting exercise is an important activity in public health. She emphasised that public health is a coordinated discipline which looked at the ultimate goal of improving the health of our communities.
This exercise provides an opportunity for you to share what goes on in your respective district, what services are offered. Dr. Nisbet would have indicated a few of them. What are some of your successes as well as challenges as it relates to the burden of disease within our population. It fosters teamwork and facilitates the sharing of best practices. The information you share today will help you all as health professionals to improve healthcare quality, safety, and positive patient outcome. I trust that you will listen attentively and ask questions when necessary.
In summing up, the Permanent Secretary thanked the community health nurses for their vital role they play in the prevention of diseases and the promoting of health and wellness in our communities. And finally, the Taiwan ICDF, in collaboration with the Health Promotion Unit, issued My Healthy Kidney Jingle competition earlier this year to pupils in grade 4, 5 and 6 at primary schools in Nevis. The competition received votes online from the general public, and judges were also commissioned for the final stages of voting. Deliberations were difficult as the standards were very high. First place winner was Miss Latavia Powell of St. James's Primary School. Mrs. Renelle Daniel, Senior Health Educator at the Health Promotion Unit, presented certificate and prizes comprising of a wireless speaker box and an all-expense paid tickets for 2 for the cinema in St. Kitts with return travel. Montessori Academy fared well in receiving second and third place winners. Alexandra Johnson received third place, a certificate and all-expense cinema tickets for 2 plus all-expense ferry returns to Nevis. Maeva, Tatiana and Genevieve clinched second place prizes comprising second place certificates, all expense cinema tickets for 2, including ferry return and a set of Wi-Fi headphones. Now, here's the winning song composed by Miss Latavia Powell of St. James's Primary School, winner of the 2019 My Healthy Kidney Jingle competition.
Love your kidneys in every way. 8 glasses of water every day. Less in your sugar. Use less salt, I say. Check pressure and sugar every day. Fruits and veg keep the doctor away. Love up your kidneys. I say love them all the way. Stay healthy. Stay healthy. Stay healthy. Stay healthy. Stay healthy. Stay healthy.
A great way to conclude this edition of On the Health Line. Until the next time, I'm Sheila James. Thank you for watching. On the Healthline Nevis News and Reviews Roundup, brought to you courtesy of the Health Promotion Unit in association with Evelyn's Drugstore.